we reiterate in the programs that we run. In talking about, we really believe in the whole food mentality, and also believe from the wellness coaching model that you kind of start where you are today, and we really focus on the things that are working for you and move forward from there. We are starting tomorrow night actually a 6-week wellness series, and a lot of the things that you heard tonight we're going to expand on in even greater detail. So things like how to train differently. If you're interested in coming to work out with a former MMA fighter, that might be something that piques your interest in a different type of workout. Or if you're interested in coming to have a gourmet chef cook a 3-course whole food meals for you, so you understand kind of where to buy foods like this, how to figure out what are good whole foods, what aren't, where to get them. You don't have to buy everything from Earth Fare, which is a fantastic resource but can get expensive. So where do you find whole foods all times of year? And what's a good recipe for something that not only you might eat, but your kids might eat too. And we really start the program talking about energy, which is, I think, probably the biggest piece. We talked a lot tonight about why, for example, some New Year's resolutions fail. We find that a big piece of that is that if you don't have the energy to work out at the end of the day or at the beginning of the day, and you don't have the energy to eat right, I don't know about you, but usually by about this time of night, I'm looking for the Chick-fil-A on the way home. So spending the time making my whole food meal is not really going to happen. So that's kind of where we come from, our whole background. We do have a whole line of massage therapy sources, or resources and services. We do primarily clinical massage therapy work. So we work with people that are rehabbing an injury. We work with both amateur and professional athletes. We work with a lot of weekend warriors. We work with a lot of CrossFitters. Because we find that people that work out really intensely share 2 things in common. One is that they try really hard to prevent injury, so they do all of the things for themselves to try to keep that from happening. Diet, being very proactive about taking care of themselves. And the second piece is when they get injured, they want to get back quickly to whatever it was that they were doing. And so we find that the combination of massage therapy, some of the evaluation pieces that we use, as well as kinesiotape, which I'm going to demo for you tonight, can be really helpful in both preventing injury as well as getting you back in the game when you are experiencing either total body soreness or a specific injury. Kinesiotape, just to give you a little background, anybody ever heard of kinesiotape? No. Now, right? Probably where kinesiotape first got its, at least U.S. notoriety, was in the 2008 Olympics. Carrie Walsh wore this black tape pretty much on every part of her body, but primarily on her shoulder. There's a picture of her on our brochures over there with her black tape. But kinesiotape has actually been around since the 1970s. It was the first tape of its kind. It is an athletic tape, but unlike those of you who perhaps in high school or college athletics had some part of your body taped as tightly as humanly possible so that you couldn't move it or do anything with it, it really has a completely different function. Kinesiotape is designed to actually support full range of motion. So unlike your typical athletic tape where you don't want to move at all, kinesiotape does the complete opposite. It actually facilitates your movement. That works really well for people that train at a really high intensity, because if we inhibit some range of motion, usually we make things worse, as opposed to making things better. If we can facilitate correct range of motion, a lot of times that actually prevents injury, but it also helps you to rehab more quickly because you're not static. You can continue to move and continue to rehab that part of your body. Kinesiotape has a stretch to it, so if I rip this here, you'll see that there's quite a bit of pull to it. That's really important. Depending on what type of brand of tape you have, some people call that snapback, which I think is really amusing. We call it recoil. But you can see the little lines on the back of the tape as well. Basically, that it helps mimic the weight of the skin, and it helps improve lymphatic and circulatory flow. So part of the advantage of kinesiotape is that it's going to help to bring fresh blood and oxygen to the area that's affected, which helps to rehab injured tissue more quickly. So as Julie talked about, when you do really high intensity weight training, you do rip little pieces of your muscle. Wearing kinesiotape, especially after a really tough workout, can help you get back in the game a lot more quickly because of that flush that it basically facilitates for your body. So for example, I ran my first half marathon last November, which was probably the most painful thing I've ever done in my entire life. But when I got up to more higher mileage, my legs were dying. So I would actually tape my calves, my gastroc, for 2 or 3 days, leave it on 2 or 3 days following one of my long runs, and the soreness would go away completely. So as opposed to kind of be hobbling the entire next week and trying to get through my runs that way, I just use a little kinesio tape, help facilitated that flush that your body does naturally, gives a little bit of extra push to it, flushes out the lactic acid, and it really decreases the lingering soreness maybe that you have all the time. We wouldn't tape you total body from head to toe, but we could do some things to help facilitate that. It's also really good for injury rehab. So the 2 ways that we use that for injury rehab, one is inflammation. Anybody ever sprained ankle, something where it blew up to this size, the cantaloupe effect is what I call it. Basically, there's not a whole lot anybody can do for you within the first 48 to 72 hours of that. Ice, and if you've got some prescription painkillers, are really the only thing that's going to work. Except, you can add kinesio tape to it. So for example, in massage, I wouldn't touch you during that time period. That's just a big no-no. However, I'd be happy to tape you. And what we find with kinesio tape, we can tape it in what we call a fan taping. So it's kind of where we overlay the pieces of the tape. We facilitate that lymphatic flow. When you take off the tape, it actually pulls all of that extra fluid out of the area and really keeps that inflammation from building there. Because of that, it's also really great post-surgically. Again, if you've ever had surgery, a lot of times the thing that lingers the longest is that residual inflammation, particularly in knees. Knees seem to stay inflamed forever. Kinesio tape is a really great way to help get rid of some of that. Probably the best example that I have personally for my use of inflammation, I work with a kicker who was a very prominent college kicker and is now trying to get back into the NFL. And he has a kicking coach now that decided that one day that they were going to change the way that he kicks his football. Well, as a result of that, he came in with his ankle looking like this, and it was black and blue because instead of kicking the ball where he normally did, he now kicks it right on top of his foot. So we did this fan taping, and he came back 2 days later, and it was completely gone. So I didn't do anything to him other than tape him. I didn't wave a magic wand. He didn't take anything. Tape is really just that effective for inflammation in a lot of cases. So that's one way we use it. The second way we use it is to either inhibit muscles that are hypercontracted or to facilitate muscles that are weak or that are not doing what they're supposed to do. So a good example of that, how many of you find by the end of the day you're doing this? Okay, I do. You know, if you've sat at your desk all day, by the time I get in my car, I kind of have to remind myself that my shoulders are supposed to touch the back of the seat. One way that we can help with that is by actually forcing the muscles of your back, your rhomboids, to contract. Okay? Because a lot of times what happens, we all sit like this for a long period of time, our pecs get tight, and our rhomboids are kind of like, I can't fight that, so I'm just going to stay in this position. Where does it hurt though? It hurts here. So instead of kind of doing this aggressive massage, a lot of times what we'll do is we'll do some massage work, and then in the end, we'll actually facilitate your rhomboids. So we force the rhomboids to contract. When you do that, it naturally pulls your shoulders back. So it immediately kind of fixes the problem, and because you can wear the tape for 3 to 5 days, it stays with you. The reason you can wear the tape for 3 to 5 days is because it's cotton-based tape. So you can sweat in it, you can shower in it, you don't have to wear it for 3 to 5 days and like stay nasty and stinky. You can do all your normal stuff in it, you can swim in it. So it's a great athletic tape for swimmers, whereas swimmers usually you never see athletic tape on because it just doesn't stay. You can swim in it, you can sweat in it, you can shower in it, and it dries just like a t-shirt. All you need to do is pat it dry, bless you. All you need to do is pat it dry. The biggest thing that people do is they get out of the shower and they do that, fast rub, dry off, tape will come off if you do that to it. If you just pat it dry, it'll stay stuck and it'll dry just like a t-shirt. So that's another advantage of kinesio tape over typical athletic tapes is just its longevity. I do have some clients that on particular areas of the body where you don't use it all that often, like on the back in particular, it can stay on for as much as 10 days, depending on how much you baby it. I have one client that hers stays on for 2.5 weeks because I swear like every day she like rubs it and pats it dry. Most people don't do that. She's a little anal about her tape. So those are some good examples of when tape could be helpful for you. Brooke has kindly agreed to be my demo for tonight because she's in pain. So one thing we typically do with folks before bit of an eval first. And I'm going to have her come up here if you don't mind, so you can see what I'm doing. So Brooke basically, she's a runner amongst other things, CrossFitter.
That's pretty much it.
Pretty much, okay. And so she is having right knee pain. We know that her ITs are tight, mainly because I just felt them over here. But she's having knee pain. It hurts when you walk, hurts when you go up and down the stairs, hurts when you pretty much do anything except for stand.
Pretty much.
Pretty much. And talk about a couple of things that you tried already as far as...
So I've tried staying off of it completely. I've tried not running. I've also tried PT, and so we've tried a lot of hip adductor sorts of exercises to try to get this area strong. Tried the nice foam roller.
Which had hurt.
Yes, which hurt like nobody's business. So, yeah.
Okay, so one of the first things that I do is I actually just look, first of all, at her knees. So you want your knees to look like headlights. You want them to actually come straight on towards you. A lot of times, folks with knee pain, one of the first things we notice, which is not the case with her, but one of the first things we notice is that a knee will kind of jackknife one direction or the other, and it's sort of this big tell. What is interesting is that if you look at her right foot, you see how it's a little bit laterally rotated? Her toe is actually pointing out that direction, just slightly. So she's got a little bit of lateral rotation somewhere between her knee and her foot, which isn't happening on the left side. So that's one of the things that we use. And then I'll probably, if you don't mind, you just walk back and forth this way. You didn't know you were going to get to do all this.
My stark white legs are like flailing about.
All our legs are straight.
So I watch her walk. And when you watch her walk, it's very subtle but when you watch her walk, one of the things that she does is that her knees actually come in closer together when she walks, as opposed to tracking straight on. So those are all clues that tell us kind of what's going on and how we might taper. What I think in this case we'll probably do, because she's got a lot of IT tightness, excuse my work clothes on the floor, but I do this when I eval. One of the things we'll probably do, she's got some IT tightness, which usually means that she's yanking on the knee from the lateral side. And when I palpate, I can kind of feel that hurts. I can kind of feel there's a pocket kind of inflammation right here, which could mean a lot of things. But again, if you push on it a little bit, you get that face. And so what we kind of do is track down. Yep.
That's kind of uncomfortable.
What about medial side?
That's not too bad at all.
Yeah.
No, that's fine.
Okay. So what we want to do is actually push up on her kneecap to kind of release the pressure there and inhibit her IT band of the muscles underneath so it's not banking quite as tightly on her knee. Now, I did this very similar type taping on Saturday, and the interesting part is this is very, very common knee pain. You know, and a lot of times what we see with people that do similar activities, or even just people over the course of time, the joints that take the heaviest amount of weight and work are the joints that obviously go first. So ankles, knees, hips, they're going to start hurting first, unless you're a tennis player, in which case your elbow. So you'll see a lot of continuity between the things that bother people in those particular joints, if we know there's not a specific injury. The other thing that's important to note, is in part of this eval, one of the other things that we do is try to figure out, am I the appropriate person, am I the appropriate place for you to start? Or are we already at a point where you need somebody beyond me? Okay, so I do send people to chiropractors, I do send people to, I call them orthopods, but orthopedists. And part of what we try to do is to evaluate, first of all, am I the place for you to start? Are we already beyond where I am? And if tape doesn't help, especially over a long period of time, or a couple of different tapings, chances are we're more likely at an injury state. If you get no relief from a taping whatsoever, it either means A, I did it really, really wrong, which is possible, or B, that you're already at a point where there's probably something more significant going on. The thing I like about tape and helping us make that decision is that tape is not going to injure you further in any way, shape, or form. So unlike some other things that you can do to potentially try to rehab yourself, tape is actually just a good feedback mechanism. If it helps, that tells us one thing. If it doesn't help at all, that tells us something else. And so we use that information to help guide the next steps in whatever treatment protocol we put together for you. We work very closely with lots of different practitioners when we try to rehab or work with someone on a rehab program because, at least in my opinion, there's no single practitioner that can take you from injured to well. I just don't think that's possible. I think you need a team of people that all come at it from a different perspective, but they're all working on an integrative plan in order to get you back in the game. So I usually do not work in isolation. I usually work with the person that's training that individual. I usually work with whoever's doing their diet plan or whoever, even if it's them. And a lot of times I'll work with whoever did their surgery or whatever their intervention was, their PT. We work with a lot of acupuncturists. So we just try to put together kind of a comprehensive plan so that none of us are just being the only person that looks at you. So I am actually going to take Brooke. There it is. I'm not going to take you in black this time because I've heard a couple of feedback that it doesn't stay on as long. So we're going to take in a different color. Do you have a preference? Pink, cream, blue? How about pink red? All right. Let's do pink. I just got the pink, so I'm excited about that. Pink, believe it or not, is not breast cancer awareness or anything along those lines. In Japanese medicine, the colors actually do mean something. They're based on energy, so pink is typically a warming color and blue is a cooling color. Cream they did because women don't like to wear pink and blue underneath white shirts. And black they did because heat makes the tape adhere. So for athletes like Kerri Walsh, for example, that are outside, black actually sticks better because the heat over the course of time with the sun, the tape will actually stay on longer. So those were purely marketing decisions.
Good advertising, you can see it on.
Yes, very, very true. Some of the other companies that make a version of kinesio tape now offer all sorts of designs. You can get skull tape, you can get flag tape. This is very cool. You can get lots of different kinds of tape. Kerri Walsh actually markets her own brand of tape now. I exclusively use the original kinesio tape just because I haven't had enough experience with the other types of tape in order to know whether it's better or worse. I was trained on how to put this type of tape on. I am a certified kinesio tape practitioner, so I just feel more comfortable with this type of tape. That doesn't mean other tape is not good, just this is the type of tape I know how to use. Rotate that way from me. Perfect. Part of what we figure out too is how much pull we're going to put on the tape. Because the IT band is a tendon, we are going to put a pretty decent amount of tension on the tape. You don't put as much tension on muscles and you put a lot of tension on ligaments. I usually don't cut tape on people, but otherwise we're going to have a personal moment with Brooke here, so. Usually for an IT taping, I probably would take it up a little bit higher. Again, heat helps it adhere. Okay. For the knee taping, I'm going to basically use the tape almost as if she's wearing a brace. So I'm going to give her a ton of upward support. Probably a little bit of torque to the outside. To try to help simulate her wearing a brace. But unlike wearing a brace, she's going to have full range of motion and not feel like she's wearing a brace. You got a little knee. So that makes it. Okay. What I want you to do, I'm going to tuck you in. I want you to pull your knees slowly towards your chest. Okay. Thought about that. Don't put any tension on the ends. The reason that I actually tape her while she's moving, at least around the joint, is because, again, we want to facilitate full range of motion. If I just tape her bent like this, when she stands up, it's going to feel real funky, and it'll probably pull on her. If I tape her while she's moving, at least I have a better shot of it not feeling quite so weird. Stand up front for a second.
I mean, I can't tell it's there.
Yeah. The other advantage of tape is that you can't tell it's there. So unlike a brace that you're wearing where you can feel that restriction, with tape, within a couple seconds, you don't even know it's on. So that's another big example, or big advantage of tape. Usually the height of benefits of tape comes somewhere between 5 hours and 24 hours after wearing it. Again, you can keep it on as long as it's possible. It'll start to actually roll at the edges when it's ready to come off. Knee taping probably lasts more like 2 to 4 days. But over the course of those 2 to 4 days, she's probably going to feel slowly an increase in the level of support that she has, and hopefully a decrease in pain. We probably will tweak this taping with her and probably do a more significant, more involved taping after a little bit more evaluation. But this is a good starting point to see if she responds to it. Any questions?
Yeah, I've got bone on my knee.
Okay.
And that's tapes like that, you know.
Depends on what you're doing and what you're looking for. Is it going to take the pain away completely? Absolutely not. If I put a ton of upward torque on the tape, could it get you through a tennis match or something like that? Probably. But no, tape's not magic. Yes, ma'am.
Can the tape help with like tendonitis?
Absolutely. Patella. Yeah. Tape is really helpful for any form of inflammation. A lot of times with patellar tendonitis, I've got a lot of teenage runners that, for whatever reason, have seen a ton of patellar tendonitis. Got the head nod going on there. A lot of times, instead of doing a big piece of tape, especially for a little knee, we'll cut the tape down the middle, and we'll actually put a big piece underneath the kneecap, and then we'll go up and around the kneecap. So we give you a little upward pressure, but then we also give you just a little bit of inhibition around the knee as well. That seems to help. Tendonitis, I think, is one of those things where you're kind of constantly trying new things to figure out how to get rid of it. The other nice thing about tape is that you can wear it under any other brace or band that you want to wear. So if you've got kind of one of those tendonitis knee bands, you can wear tape underneath that. Same thing with tennis elbow if you wear, any sort of compression sleeve or anything like that.
There's not something you can do yourself, right?
Actually, usually I take about I usually say it takes about 3 times for us to A, get the taping correct for the person, and B, for us to make sure that we're seeing consistent results. Once we get to that point, I usually can figure out a simplified version and teach you how to do it at home. And then a lot of times what will happen, especially with my athletes, is they'll come to me to tape them just for a match or just for their competition. And then they can kind of tape themselves at home for training. So there's more information about kinesio tape over there, my card, all that good stuff. If you have any questions, please feel free to email me, call me, whatever.
Thank you.